Good day, everyone. I am Donabel Marina Basca, and for today, I will be talking about personality and its relation to mental health in emerging adult sexual minority men. Young sexual minority men are more likely to experience a higher degree of mental health burdens when compared to the general population. This includes depression, generalized anxiety, and post-traumatic stress disorder. Increased experience of sexual minority stressors such as those related to victimization or internalized homonegative prejudice, and lack of accessibility to culturally competent and affirming mental health care have been among the many factors implicated in this persistent disparity. Whereas mental health conditions such as depression and PTSD have been widely studied among young sexual minority men, especially in relation to the HIV epidemic. Few, if any, investigations have examined and considered the occurrence of personality related pathology in this population. Research objectives. Given the extant literature, the aims of our analysis were as follows: to describe the extent to which certain personality features were common within this young sexual minority men sample, to examine demographic differences in personality pathology among young sexual minority men, and to delineate associations of personality pathology with mental health and psychosocial well-being in sexual minority emerging adult men. Our first aim was to describe the sample in terms of the personality dimensions examined by the SAPASR. As such, descriptive analysis was first conducted to assess the distribution among the 8 individual items of the SAPASR. From there, we analyzed differences in personality pathology by demographic states and the associations of personality pathology with mental and psychosocial health using parametric statistics in the form of chi-square test of independence. Finally, a logit model was created and a regression was performed to allow for multivariate analysis of factors. For the purpose of both bivariate and multivariate analysis, the CAT score of 4 on the SAPS-SR was used to differentiate those more likely to experience personality pathology. Summary of findings. The primary aim of this study was to examine personality traits associated with personality pathology in a diverse sample of young sexual minority men and further to determine whether those traits are associated with other factors of interest. This data also suggests that personality pathology is associated with the psychosocial and mental health of sexual minority men. Lastly, the measures included in this study to address non-personality related mental health may contribute to some measurement ambiguity as they attend to symptomatology rather than diagnostic criteria. More precise measures to depression and anxiety are included in the larger study from which these data are drawn. However, their administration occurred at study visits, not concurrent with the assessment of personality, and therefore would not be appropriate to include in a cross-sectional analysis. While we acknowledge this as a limitation to the precision with which we can analyze associations between mental health conditions, both racially and economically sexual minority men, we believe it is imperative to continue bring focus and awareness to this population. The associations that exist between personality pathology, psychosocial factors, and mental health in young sexual minority men further suggest the health problems and health conditions within this population are co-occurring and potentially synergistic. Moreover, the differences that are noted across race and ethnicity reinforce that differences in health states exist even within sexual minority populations. Taken together, these findings support approaches to care for this population that are holistic and attend to the entire person. As the provision of health care of young sexual minority men moves farther away from a strictly HIV focus, we must begin to consider other types of pervasive and enduring conditions like those associated with personality pathology that may have a lasting influence on overall health. In doing so, it is necessary to recognize personality as not only a health factor in its own right, but also a factor that significantly impacts engagement in health behaviors and engagement with healthcare. I learned from this study that sexual minority men often indicate greater worry and anxiety, often related to HIV, experiences of discrimination or harassment on the basis of sexual identity, and how they are perceived by individuals and by society more generally. And these worries may in turn affect personality factors such as the tendency towards avoidance and mistrust of others. The decision to examine personality traits and personality pathology also has particular relevance given the age of young sexual minority men. That's all for today. Thank you for listening. God bless us all.